Hello and welcome. This is Deepak Mishra and you're watching DMiNetz International. Today, in this video, we are going to interview Dr. Ose Renoma Oasia. The name is a little difficult for me to get used to, but then he's one of the doctors. He comes originally from Nigeria and has been in Germany since last couple of years. Recently, I had an opportunity to have a conversation with him, and I was very humbled to find out that he has been watching my videos and my videos could provide some value, some assistance, some guidance to him during his career path. So today we take this opportunity to interview him, to know his pathway, his motivation, why and how he could circumvent and navigate through the entire bureaucratic system over here, pass his exams, the Fachsprachenprüfung, Kenntnisprüfung and everything, and currently working as a resident doctor in Germany as assistant arts in Weiterbildung. So, Dr. Oesya, hello.
Hello, yeah. Good morning or good afternoon, as the case may be. I'm quite excited to have this opportunity to talk to you about my journey to Germany. It actually dates back to 2016 when I um, stumbled upon your site, YouTube, and because I was already curious about getting to know the path what I can follow up on coming to Germany, and your videos were quite very helpful. And after passing my B1 exam in Nigeria from Goethe Institute, I decided to come over to Germany after applying also for a language visa, which eventually I got. And then I eventually came here in May 2017, and I attended my language courses, which took me a total of about 4 months because I already had a B1 foundation and also learned some level of B2 already in Nigeria before I came down to Germany.
Mhm.
And
So,
yeah, that was
mm,
it.
okay, I mean, in short, you have already explained the entire pathway that you went through. That's very nice. So,
Okay.
before we go on the details of how you did each and every step that you just explained, I would like to know what was the motivation? Like, why did you choose Germany over other countries? Like, we know that Nigeria is also one of the say like India, it has been a colony. We have been we speak English and we don't speak much German like in our own countries, like in India or in Nigeria. So people from our part of the world prefer to go to English-speaking countries for USA or UK or New Zealand, Australia. So in your case personally, what was your motivation? Why did you come to Germany?
Okay, my motivation to come to Germany, before I decided for Germany, I had already considered other options like the UK and the US, and which for me I felt was a very expensive path, considering the amount of resources and funds I had at my disposal. And I also decided to look at Germany. I had just graduated from the university then, and could choose whatever path I wanted to follow up on. And with the
Hmm.
resources I had, looking at Germany, I realized that the financial structure there needed me to have basically this blocked account, which I could actually finance from my own resources, so to say. And
Hmm.
I decided, and the other hurdle I needed to pass through was then to learn the language. And then I
Hmm.
said to myself, if this were the requirements needed, I think it's doable, first and foremost, from my side. And the motivation, the fact that Germany can boast of a very good quality healthcare, not just for its citizens, but so people come from all over the world here to also take treatment, and then the quality of teaching and the quality of medical care that I will also, at the end of the day, get to also practice. These
Hmm.
were already things that motivated me because back home where I practice, it was already beginning to look like a monotony, doing the same thing all over and over again, and it wasn't so challenging. And then I wanted a more challenge, as well, a more meaningful life to have, not just sitting in one practice and doing the same thing all over again. And for me, that was enough challenge, enough reasons to say I have to take my life to the next level. I have to do much more than I could actually give more than what I'm doing right now. And yeah, those were the things I put together, and then I decided to embark on the journey.
Very well. That's very. I mean, that is a very genuine reason why. That is why most of our colleagues and most people who want to move to Germany, they all have similar motivation. That okay,
Yeah,
the healthcare system is good, the lifestyle is good, and they also think about the future generations. And okay, if we once settle in a developed country, then the life for future generations would also be more comfortable. That is what the assumption is. That's what the presumption is.
yeah,
All right. So, yeah, then you mentioned about the history that you did your MBBS, like the graduation from Nigeria, and then you so you came here in May 2017. You said the
yeah.
language you had done already in Nigeria, or you did the language completely here?
Okay. Yeah, the moment I decided to come to Germany, I started studying the language already. I had to contact yeah, some private tutor lecturers,
Hmm.
Nigeria, and then well, the motivation came actually just from my own initiative. I
Okay.
bought the books that were necessary, started learning from A1 to A2, and eventually to B1, and yeah,
Mm.
so I could already understand from say 50 to 80% B2 level before I took the journey to come, as I took the step to come here to Germany. So I could
Okay.
already read articles in German,
All
before.
right, all right. So
That's
you were well versed with the language before you even came to Germany. That is what I always emphasize to our candidates or consulting candidates, that language has to be there, because otherwise, if you're coming here just without language, then you're just wasting time, because you will not enter the system, you will not pass those exams till your language is good. About language, we'll talk in the later part of the interview. Here, I would like to know that after you came here in in May 17, how was the pathway? Like, what did you do after that? You did language, the further language you said, and about the interviews, about exam, how did that all happen?
yeah. So immediately I finished my language course because I took another refresher B2 course, and then in addition I took medicine for Deutsch course as well, which lasted about 4 weeks. The moment I was done with this process, I started applying for positions and interviews, and
Mm.
just like it is anywhere in the world, I got a lot of rejections. A lot of rejections. I remember also watching one of your videos that also encouraged people to continue to apply despite the rejections that they get. And this was also a motivation for me not to get discouraged. And I kept on applying and applying until I got some openings. And I think the chef has wanted to speak to me on the phone first to also get to know me. And we did the first telephone interview. He was quite impressed with the way I spoke with him. And he then also arranged for a one-on-one interview, which also went well. And eventually, I got an opportunity to work with this hospital. But yeah, that was the way it went. And so eventually, I got a very good language basis first and foremost. Then, because at the end of the course, I could already discuss with the chef, as although he spoke very fast, but
Mm-hmm.
but though the content and the core message of whatever he said was
Mm.
clear to me, and I was also able to respond to him adequately, and he was, very, very impressed with that, and that was how the journey
That's
started. Yeah.
nice. That's very impressive.
Mhm.
Like one interview and you get selected in that very interview. That's like
Yeah.
pretty impressive. All right. So you did the Fachsprach, and this was in a state of Northern Westfalen, or where was
Yeah,
that?
this was in North Rhine-Westphalia. As at the time I got this opportunity to work with the hospital, I had not yet done the Fachsprachenprüfung. So it was more like a contract was designed for me that initially you will be an hospitant, like an
Hmm.
observership by us
Yeah,
by
yeah.
with the clinic. And if you get to pass your Fachsprachenprüfung in the course of your hospitation program with us, then you
Mhm.
can start up working proper, so to say. So
Mm.
I got the job in October 2017, and
Mm-hmm.
I was able to get an appointment for the exams in November 2017.
Mm-hmm.
That was so I actually had a 6 weeks period hospitation or
Okay.
observation time with the hospital, and I went for the Fachsprachenprüfung.
Okay.
That was in Munster so then, and
Uh-huh.
there was a lot of comments that the Munster section or art, so to say, it's like the Munster or the monster of Germany. But
Yeah.
I didn't allow that to get to me. I just did my work, and I think I could also remember also you actually did some videos on that. You know, as I could actually place my timeline as always on the videos that they were always very timely. I was preparing for the Fachsprachenprüfung, and here you come with a video on what you need to take note of the Fachsprachenprüfung. So alongside with the videos that you did, and also with my own personal work, it made everything a bit easier. You know, I read a lot. You also did suggest then Amboss, you know, that
Mm-hmm.
was one of
Yes.
the materials one could read. And then there's Falbuch, you know, one could also study. So going through all of this with the cases and a lot of reviews with colleagues also in the hospital who I could
Mm-hmm.
present to. They could already give me an assessment. Hey, doctor, here is a little bit faulty. You need to work on
Mm.
this part. And I also did a lot of one-on-one presentation. I had to read aloud to myself, made some,
Mm.
so to say, a monster presentation, really singing
Mm.
and talking aloud to myself, and trying to do all of this within the time limits that was required, because the exam is also time bound for each section.
Yes.
And
Yes. Yes.
I could see that yes, I was beating the time. I was beating the time. Initially, it was longer, but it became shorter, and
Mm-hmm.
I knew I was yes ready. And the exam came, and I went there. Met we had quite a lot of persons from different parts of the world. From
Okay.
yeah, so you go into your office, you be called in, do the normal registration, sign in, and eventually you are presented to your doctor. So that was how it went. Yeah.
And what was your case in your Fachsprachenprüfung?
Yeah, the case in my Fachsprachenprüfung, I think I had 3 examiners there who sat there before me, and he started giving the history, the anamnesis, and everything. And I was able to do the history taking. Eventually, although as they say, always the diagnosis is really not the big deal about the exam. They just want to see how you can communicate with your seniors, so to say, your
Yes.
over us. So to how are you in a position to be able to analyze cases with them, to be able to come to a conclusion. But in this
Mm.
case, I had a case then of a patient that had a prostata you know,
Okay.
so he had it has prostata as a prostate cancer, so to say, and then he
Mm-hmm.
had a malignant transformation to the
Okay.
spinal as well, vertebral
Spinal
column.
column. So
Yeah,
vertebral
yeah,
column.
yeah.
Yeah.
So vertebral column, so to say, and then he developed as a result of that a weakness of the lower extremity,
Okay.
and
Okay.
yeah, so this was the case, and I needed to talk around all of this, understand what they were saying, and then eventually come to a diagnosis, and not just making a one-time diagnosis. You must also have some differentials, because it is not to
Yes.
say that is what you think it could. It's already at this point in time. It's only so to say you are only suggesting it.
Yes.
It could also be other things. So that's what sort
Yeah,
of
since you do
yeah,
not have any
yeah,
diagnostic
yeah,
measures, you have
okay,
not seen any CT or MRIs, then
yeah,
you cannot give a definite diagnosis. That is correct.
yeah.
So during your Fachsprachenprüfung exam, did they also ask you medical questions, or were the questions mostly language related or the information transfer? Because
Mm,
what we have noticed is that, or what we know from last few years is that
mm,
in Fachsprachenprüfung, what they judge or what they want to know is that did you understand everything that the patient said?
mhm.
Did the patient understand everything that you said? And did you ask everything that had to be asked? Okay. So
Mhm.
the analysis of the information, that is not given much importance in other states, at least, like for example in Bayern or Mecklenburg-Vorpommern. That is, but in Münster, I've heard that the exam of Fachsprachenprüfung is also of Kenntnisprüfung level, and there they focus on medical also.
Yeah. Yeah, it was actually so in my case as well. Despite the fact that we talked about, yeah, coming down to the diagnosis, when we got to the ask express, that is the doctor to doctor, um,
Mhm.
I think I was also asked to talk about how one will carry out a thyroid scintigraphy. As a this is,
Okay.
yeah, I was asked to explain the process. You know, more like
Okay.
Aufklärung. Mm.
Aufklärung. Okay.
Yeah, so it's also important beyond just being able to speak and
Mhm.
also communicate. You should also be in a position to be able to explain something to your patient,
Mhm.
some basic diagnostic Verlauf to your patient.
Mhm.
Like
Mhm.
probably if you want to do an echocardiography, you should be able to explain to the patient what it's all about. If you want to
Mhm.
do an ultrasound, you should be able to let the patient understand what it's all about.
Yes.
So in I think in my case it was a scintigraphy from the thyroid, and
Mhm.
they wanted me to be able to explain what that is all about to the patient in simple terms, so the
Mhm.
patient can understand what you're talking about, and
Okay.
without necessarily having you must also calm the fears for this patient, because sometimes the patient come, they are ignorant of what is happening to them, and you
Mhm.
must bring them to the position where they understand just like you do, and calm
Mhm.
and allay their fears as much as possible.
All
And I
right.
think,
All
yeah.
right. Okay. And you took your Kenntnisprüfung also in Northern Westfalen.
Yeah, after I had passed the Fachsprachenprüfung,
Mhm.
immediately I started preparation for the Kenntnisprüfung because I knew that was
Mhm.
going to be the next challenge.
Mhm.
Bought the necessary books that were necessary to buy. Amboss was one of them, which I could get from the internet. And then
Mhm.
from my daily exposure also in the clinic where I worked, it makes life a little bit easier because I could read and at the same time see the
Mhm.
clinical manifestations of these in the patients. And then there was an intense ambition or the intention to read on a daily basis, to see to it that because you needed to read in German, it is not what you're reading in English and you think, okay, I already know it and I'll check it again in 2 or 3 or 4 weeks time. No, you have to maintain a very close contact with your informations. Otherwise, you're going to lose them. So
True.
I
True.
then and that was what I did on a daily basis. YouTube videos from all over. You go to YouTube, type in the topic you want to read about. You're going to get a thousand load of information. If you read it in the textbooks, you don't understand it. Go online, check up these things
Yes.
online.
Yes.
You
Yes.
are going to get people who are going to explain these things to you in quite simple words, and it makes life easier for you. You become lighter. You don't have to have headaches over these issues. And if you have the opportunity to also work in a setting where you can discuss with people about cases,
Mhm.
then you can also
Mhm.
go ahead and do that. Oh, I do not have an understanding about this concept, because it's all about concepts. I've come to realize here, you understand the concept for a particular management, and then you follow these steps, and then it becomes a part of you. You can follow them every now and
True,
then.
true.
Yeah.
This I have also noticed here that since see, if you Google a particular disease
Mhm.
on internet, I mean you Google it, you will find so much information that you don't know what is relevant for you for that exam.
Yeah.
Like that the information might be so deep that it is of Fakat's level, and it
Yeah.
might be so native, so basic that it is of a school level. So
Yeah.
you or a layman level. So you don't know how much. That is why with this, like I have noticed this problem since last couple of months, and I'm actually at present working on formulating a online tutorial in orthopedics and trauma, especially for relevant topics and relevant depth for Fachsprachenprüfung and Kenntnisprüfung. So that orthopedic, because many people have cases like in your case also, when you say that Wirbelsäule, the vertebral column was metastasis, then that will be fractured Wirbelkörper, or say fracture gefährdet, risk of fracture, everything. So orthopedics and trauma takes a very huge role in these exams, and that is why like last few weeks I have been working on. So I hope that will come soon, and then that people who have that problem, that okay, how much should be read,
Yeah.
That is the question. That information is there, everything is there. How much should be read? What is
Mm-hmm.
relevant? What is not relevant? That
Mm-hmm.
will be taken care of once that
Okay.
tutorial comes out.
Mm-hmm.
So
Good.
let's see. I mean, that was not part of the interview, but then since I've been working on that, so it keeps like I just it came out that okay, and that is
Mm-hmm.
a. I mean, I find it is a good idea. I don't know how the candidates will respond to it. We'll see about that,
Okay.
how it works out. So, all right. So then, yeah, then you took your Kenntnisprüfung and then you started working as an assistant arts. And so,
Yeah.
which department are you working in at present?
Okay. I started up in neurology so neurology, yeah, because that was the
Hmm.
position I got earlier on. But I was in a rehab centrum as a rehabilitation center,
Yeah,
and
yeah.
in the course of my work, I came to like the department rehabilitation because
Okay.
it gave me a lot of joy to see that people come most times after stroke events and
Mm-hmm.
after the acute they've overcome the acute phase of the illness. They come to you, they want to learn how to walk all over again, and you can
Mm-hmm.
actually support those people bit until when they get the capacity to be able to walk again. And
Yeah.
you get a lot of feedbacks from this patient, a lot of lovely words, a lot of thankful messages, and that
Okay.
actually gave me a lot of impetus. Why don't you just think about a career in this line? So, and there's also in the rehab, there are lots of sub specialties, so to say. You have the orthopedic rehab, you have the neurological
Mm-hmm.
rehab, the cardiological rehab. So since
Yeah.
with my neurological background, I decided to go into the physical and rehabilitation medicine with sub-specialty in the neuro
All right. All
segment.
right.
So yeah, that is where I'm
And
currently.
and are you enjoying it?
Yeah, it gives me a lot of joy on a daily basis to see
Wonderful.
to it that I can speak as or relate with the patients and motivate them too, because I see myself as a product of motivation. And yeah, so I can also encourage these patients, despite the challenges that are before them, they want to walk again and they are already doing what they have to do to get to their goals. So you are there to motivate them, because the neurophysiology is also a tile or a part of this management that
True, true.
they really need to appreciate very well. So being in the position to see to is arrest any acute case that may want to come up and make sure that they are always in a position to see to it that they achieve their goals. For me, it's top service.
Wonderful. That's wonderful.
Yeah.
Like we also during our work in orthopedics and trauma, we also motivate a lot of patients to go to Reha where they will be motivated further.
Yeah. Yeah.
We tell them that okay, fine. I mean, we have done the surgery now. Rest, the Reha people will motivate you
Yeah.
and train you, and the muscle aufbau and everything will be
Right.
done over there. So you relax and. Now you have pain like with mostly the people who are with us they are in pain basically so
Yeah.
their stay with us is not very pleasant
Great state.
and by the time that pain is little less the things are little better they're at the verge of going. That is also the aim that okay in acute Krankenhaus you make them little better then you send to Reha where there are nice people like yourself who will
Yeah.
further motivate them and encourage them to get back their life on
Yeah.
track.
Yeah. That is
Wonderful.
it.
So, okay. So when now, like you have been here since 3 years now, you see that I mean every year the trend of more people coming to Germany. I mean the trend is always increasing.
Yeah.
So I don't know. I mean I have not seen many Nigerian doctors coming
Mhm.
to or doctors from Africa coming here. So do you think there is a specific reason for that? Are they not preferring Germany, or there is shortage of information, or how is it?
Yeah. I think first and foremost, the shortage of info is one. And secondly, the language barrier. Not so many persons are patient enough with the German language
Hmm.
to really come to the level where they can speak it conveniently. It needs to come from a conviction that this is what you really want to do, because there are too many steps that may really want to throw you back off. The bureaucracy is already there.
Yes, yes.
Then again, the understanding and learning the language in itself is also there. Till today, I still learn the language. I still buy books to ensure that I learn the language and
Hmm.
speak more fluently. So it's a pathway that is it's worth the while at the end. But the journey through it, where you have to go through, is filled with a lot of hurdles, and it all depends on personal inclination at the end of the day. Are they ready to go through this and come out at the end of the day on the other side, or you feel, no, I don't think language is a thing for me, and I just want to continue on what I've been doing. So
Hmm.
it's an individual decision, and
Hmm.
particularly for us back home, the widespread information that, oh, you have to learn a new language, and before you get into the system, it may be very tough and all of that. Yeah, that is the truth. And life in itself is so. Whatever it is you want to embark upon has its own sets of challenges that you just
True,
have
true.
to embrace. And if you do that, embracing it, and despite whatever knockdowns that you get, you tell yourself this is what you want to do, then you go through the feelings and then come out at the end of the day. In the course of my learning the language, I failed some language exams, failed B2 while I was trying in Nigeria, but that
Hmm.
wasn't the end of the road for me. I kept on pressing. So you can't just say it's a path I will take and then I just go through it like it's smooth sailing. No, it's filled with a lot of challenges. Yeah.
Exactly. I totally believe I'm a believer in that kind of attitude that, okay, the only your failure becomes permanent when you stop trying.
Yeah.
Yeah. So if
That
you
is it.
stop trying, then you are failed. Otherwise, every step that you take, important things that after you fail, you don't lose hope and you keep working further. Like, everybody has the limitations. Everybody have the circumstances. Many people say that, okay, my circumstances are not that I can sustain this project any further, or any, or not just PG in Germany, but any for that matter, anything in life. But then there are other who are in same circumstances, but then they have that gert. I would say that they would say that, okay, fine, I will walk that extra mile. And I believe that that is what makes all the difference.
Yeah.
That conviction, that belief, that leap of faith, that, okay, I am going to do something good for me. All right, good. So with this small, it became a few minutes of motivational talk.
Yeah. Yeah.
I mean, that is also important. That is also
Yeah.
required
Mhm.
for. I mean, with my candidates from consulting, I make it a point that I regularly stay in touch with them, and I also motivate them during when the things are not very bright and gloom. I
Yeah.
mean,
Yeah.
uh, so yeah, that is also important because it's a long journey, and a little bit motivation has to be there.
Hmm.
So. The last part of the interview, I would like to ask you, or like want to know that what suggestions or what tips would you like to give fellow doctors who plan to come to Germany or work in Germany in future, or who are in the
Okay.
pathway at present?
Yeah. Yeah, I would want to really say to those, if you are taking the step to want to come to Germany, what we've already said from the beginning, the language is a core part of it. You must strive to speak it as fluent as you can, and when that hurdle is shown taken care of, then you have to talk about you having to learn, in the German language again. You must have that virtue of patience. You learn the language very well. Be very patient with the process. It's not going to be an overnight switch. It's going to take a time. It's going to take its time, and then when you are dedicated and committed to the path, regardless of the hurdles and all that you're going to go through, I think at the end of the day, it's going to be a worthwhile path and a worthwhile decision that you have taken, not just for yourself alone, but also for the generations that will come after you. So that is it, and I wish everyone good luck and success also on this path, and with a lot of encouragement. And I think with also you need also information, and that is why with a system that Dr. Meshak has already put up, it can really guide you, on areas where you are actually lacking, because it's all about information. At the end of it, information brings you forward. And when you have
Right.
the right information, have the right set of people around you that can guide you. I think it will take you towards achieving your goals as fast as possible. So, essence, as a first sense, your language, work on your language, be dedicated, be committed, be motivated, and always seek information. And yeah.
All right, very nice. So thank you very much, Dr. Osya, and I'm very glad once again that like watching you watched my videos, and like as you mentioned, that was very timely and it helped
Yeah,
you in a stepwise manner. That gives me immense joy that okay, the work that I have done has helped somebody.
yeah,
Like to, I mean, videos can only help to certain extent. Yeah,
yeah,
so mostly it is the person's hard work and dedication and conviction that
yeah.
is, I mean, but still in some small way, if these videos could contribute to your success, then I'm very happy about that, and I wish you all the best for future, and
Thank
thank
you
you for
very
taking
much.
the time for this video.
You're
My
welcome.
viewers will definitely like and find this video very inspiring for them. All
Thank
right,
you.
guys, if you like this video, please share it with your friends and family and your colleagues, and subscribe to the channel. If you have specific questions for me or for Dr. Ossia, you can write to the comment section. We will try to answer them as and when we find time. All right, then. Thank you very much. Have a
Yeah.
nice time.
Bye.
Bye bye.